Had some technical difficulties. My computer decided to do an update and then didn't reconnect some of the audio that we were working with. Dr. Patino in his home office. And today we're going to be starting hopefully a two-part series on a very interesting topic, neurodiversity. For those people who don't know what that is, of course, Doctor, if you could just give a quick definition, because it is a relatively new term, correct?
Well, it's a term that has been used. It was initially developed in the 1990s, and it kind of has catched up over time, like most concepts. It's a very unique concept because it looks at the functioning of the brain from a different perspective, right? In medicine, we normally are used to diagnosis, meaning identify a problem, right? And separate normal from abnormal people, right? So, especially when it comes to behavior, we like to define what is abnormal, right? So, anything that is outside of abnormal becomes normal, even though we've never defined normal. And I'm not just running riddles here. I mean, that's basically a problem with not being able to define normalcy. Okay. So
Hmm.
neurodiversity really has to do with a different way of your brain functioning, not necessarily looking at it from the perspective of you have an illness or not, or you have a diagnosis or not, but recognizing that are people whose brain works differently and it has advantages and disadvantages. And we have to actually become more accepting of them.
Now, was this but prior to this term being more accepted, did they call people with neurodiversity something else? Autistic, ADHD? Is this a term that's replacing something that was used in the past, maybe incorrectly?
No, I mean, the diagnosis continues to move along parallel to the concept of neurodiversity. And we have to be careful with this because each one of the subfunctionings of neurodiversity, whether it's autism, ADHD, dyslexia, and some other learning disorders, right, are still being diagnosed. But we need to understand that they need to be diagnosed to provide the individual with tools so they don't feel so vulnerable, so they don't feel that they're not as accepted. So the problem is that when we talk about diagnosis, sounds like if something that can be fixed or it can be reduced to a point where people are going to be different. And when it comes to neurodiversity, in particular with ADHD and autism and dyslexia and some other learning disabilities, some people are starting to consider schizophrenia maybe a form of neurodiversity.
Hmm.
Is that these are not issues that can be changed. You cannot take ADHD away from an individual. You cannot take dyslexia and stuttering and Tourette syndrome and autism from an individual. But you can provide them with tools so they can feel that they function more in the world that we have defined as being normal, right? So in that context, we still say somebody has autistic disorder, right? But not to label them but in order to understand their functionality, so we can provide them with the tools that would allow them to be more functional, basically. So, in
And
other
you
ways, they're looking at natural variations of how the brain is connected.
Okay, and you just mentioned something. You said, people who have disorders. That's distinctly different than somebody who has a mental illness, such as bipolar or something else. So would somebody, for example, with manic depression, is that under the rubric of neurodiversity, or is that distinctly different?
That is distinctly different because of the natural history of it. Okay. Now, you can make a case that there's some neurodiversity involved in bipolarity. Let me give you an example. For instance, you can have somebody who's born from both parents having bipolar disorder, but the parents weren't diagnosed until their teens or early 20s, right? They get together, they have children, but the children don't have any symptoms as we define them in the context of manic depressive illness. They've never had mania, they never had depression, but they have the genetic substrate for it, right? And what we don't know, and there's some evidence that shows that just having the genetics of it may make you have certain personality traits, right?
Mhm.
In terms of emotional intensity, sensitivity to rejection and criticism, being very creative, like most neurodiverse people are. So there is a whole process in place to separate those two. So as we progress in psychiatry, we need to become more open-minded to the idea that it's not just diagnosis and it's not just treatment. It's about understanding the individual in the context of their biology, meaning their genetics, background, exposure to drugs, I mean, all kinds of different things. Your psychology, meaning your development and your sense of value as a self individual, and then the social environment. So, in that context, is where neurodiverse individuals seem to have the most trouble.
Mm. Okay, so if you take away the actual typical mental illnesses, schizophrenia, bipolar depression, manic depression, what is the list? You mentioned some earlier briefly, autism, ADHD, things like that. But is there a specific list of what would be considered neurodiversity? Because you've said this in the past that we can define abnormal, but it's very hard to define normal. So is that kind of another aspect of this, of then taking those gradations that are on the edges of illness or as a true abnormality and
Well,
redefining them?
yes, and it is a reflection of those of us that consider ourselves normal, right? And I don't know who told us that we're normal, but let's say that we fit into the category of those of us who say we're normal. What has happened over time with neurodiverse individuals, they're kind of shunned away because they're different. They
Mm,
think different, they behave differently, they're socially different. So those features have kind of forces to say, why are they different, right? Instead of celebrating their diversity, meaning they have a lot of things that are very different than those that are considered normal, right? But they are to some degree special in a sense that they have a lot of attributes that those of us who are normal don't have, right? So let's mention some of them. Autism, for example, right, is the quintessential um, neurodiverse disorder. Right, ADHD is another one, and these individuals tend to be tremendously smart, most of them, and there are different levels of autism. There's different levels of ADHD, but they have a very unique cognitive process in terms of communication, problem solving, right? Certain abilities that those of us who are normal don't have. Okay,
mm.
so they can be very good at a lot of different things. But in the autistic population in particular, they are socially distant. They don't interact very much. They can be very rigid in terms of how they're managing things. So then it becomes important to understand that we have to be more inclusive, right? We need to expand the borders of normalcy and include more people, right? And celebrate the diversity.
And you've mentioned, at least in the notes that you've provided me before the show, we always do that, of course, the difference between the
Mhm.
medical model and the neurodiversity model. Can you define those and explain to the listeners what that is?
Can you repeat the question so I can answer it
Yeah.
correctly?
The difference between the medical model and the neurodiversity model.
Well, the medical model basically talks about disorders, illnesses, syndromes, things of that sort, right? And we look for syndromes that we can cage, put in a box, and say, you have this problem or you suffer from this disorder, and these are the treatments we have, right? The neurodiversity community looks more at the context of adaptation, meaning you're born with a different way of functioning in your brain and you're going to adapt differently. And those of us who are not in that group of people need to be more welcoming, okay? And instead of being more rejecting. And it is in the nature of humanity to be rejecting to things that we don't understand, right? So if you go to school and the kid is different than you even consciously or unconsciously going to ask, how is that person different? How come we can relate? How come we can communicate? And we need to make more of an effort to communicate their way instead of expecting them to communicate our way.
And do you think so? This is kind of more of a really a definition for us laymen and the people who interact with these people than a medical term.
Yeah, but we have to be careful with this. I mean, I recently wrote an article about neurodiversity in terms of inclusiveness, but also in terms of treatment, kind of trying to put together the medical model into the idea that there are tools we have in psychiatry that can be provided, right, to certain individuals to facilitate their life so they can be more functional in the context of their own lives. And it was very interesting to hear back from the neurodiversity community in terms of some of the comments. And one of the issues had to do with the recommendation, for example, for applied behavioral analysis. Applied behavioral analysis is a form of therapy used in autism and ADHD. Often it's a form of cognitive therapy and it's more hands-on, right? Not getting too much into trying to modify the way people think as much as utilize your skills to become more adaptive. And it was very interesting to hear some people talk very negatively about ABA in general. And those are the risks of these types of movements, right? You get into issues like we had to deal with the vaccine movement, right? People that end up looking at these things at black and white. Of course, ABA therapy is not good for everybody, okay? And there's some people who shouldn't get vaccines because of the immunological system, but it doesn't mean that you deny and reject, right? So we have to be careful. And one of the reasons I'm very interested in putting these things together in terms of the medical background, the psychiatric background, and the cultural background is that we need to make sure that the neurodiversity movement doesn't become a cult, right?
Mm.
That's very dangerous. So it's very important that we maintain it within the context of the individual that suffers the different way of thinking and facilitating and providing them tools so they can be more adaptive within the context of what they consider normal.
Now you're always been more of a cutting edge and I guess a forward moving, forward thinking doctor in your own right. Is this being accepted more by the psychiatric community as a whole, or again, because you say there's that risk of it becoming a cult, or is this really more of a ground roots thing? Where is this? Where's the acceptance of this on both sides?
I think that there's a lot more acceptance today. I mean, having been in this business for 35 years, 34 years, I have patients that I saw as suffering from diversity in autism and ADHD when they were 13 years old, and now they're in their 30s, right?
Mm,
And I have witnessed the difficulty for them in terms of adaptiveness. And most of it is because we do not provide them with the tools or the environment for them to flourish, right? So we are actively and passively rejecting, right? I think that there's been more acceptance, hence there's been a lot more diagnosis of autism, right? And I don't think it's purely because they weren't there before, they just weren't being recognized.
Isn't
And
that kind of like what happened with ADHD? For the longest time, it was just it was marginalized, and when people started really looking, they saw the gradations of ADHD, either on the AD side or the HD side, or the like, and it started expanding. Is that kind of the same thing that's occurring here?
yeah, when you and I went to school, ADHD kids were problem kids and were shunned away, and they were eventually kicked out of school, right? Because they were too intense and they weren't fitting into the norm. So the problem is that we don't need to be working on making these people fit a norm. We need to accept the diversity and expand the norm, if you may, right? In terms of, and I'm not saying that there are no, I mean, there are people that have so severe of an autistic disorder or so severe of cognitive difficulties that they become more of a total care individual. But these individuals are very functional, right?
Mm,
And then we have kind of borderline syndromes, people that have certain autistic qualities, but they can still have some social interactiveness and they can be very successful. Some of them become very successful financially. They're very smart people. So some of them become very creative in terms of art, writing, right? Because the way they think is very creative, is very different. So they're overrepresenting on some people that have a lot of success. But it doesn't mean that they have success in the context of how we have defined it, right? So my approach with individuals that suffer from neurodiverse way of thinking is to listen a lot, to pay attention, to try to help them guide me of what they need, instead of telling them you had to fit this mold.
I find it fascinating. I have a high school friend who's a successful orthodontist on the Monterey Peninsula in California, and she let me know that both of her boys are neurodiverse autism, and that she had synesthesia. I never knew that, and I find it fascinating. I started asking her questions. What does infinity look like, or smell like, or taste like? Instead of being a negative, I just find it incredibly fascinating, and I guess that's part of this, right? To like we've said before, with even mental illnesses, when we people start looking at manic depression and schizophrenia much more like a physical illness, like uh, um, whatever. Oh, you have the glucose. My brain's not working on this one. Diabetes. Excuse me, diabetes.
Mm.
And same kind of thing. If we start looking at these people in a slightly different way, and as you mentioned, they have some amazing strengths. What are we looking at there? I mean, I like it as like these are super people, in a weird way.
Well, they are, and I have several members of my family that have suffered from either autistic features, um, ADHD, autism, right, at different levels. So I find it fascinating to see their lives and how different they are, and how they become um, close to people who are willing to listen to the point of view without being rejecting and critical. Let me give you an example. When I wrote this article, I wrote another article recently about adults with neurodiverse type of disorders, and a future physician sent me a note. I mean, a comment on my blog, and it basically telling me that she wants to be a doctor, but she recognized that she has certain ways of being, both socially and creatively. And she told me all my life I have had difficulty with tests, right? But if I draw the concept, I can do fantastic in a test. So she took her exam to go into medical school, and she did most of her tests with drawings,
Wow, that's
and she
incredible.
had a fantastic result, right? And she thought of herself as being weird. In my article, actually, and she said in her writing, is that she was telling me that she was very thankful that she could hear that from a psychiatrist, that she's not weird, that she's different, right?
No,
Interestingly enough,
she's diverse. I mean, that's part of the term, right? It's really getting
exactly.
our heads around that,
And
and
she
hope.
started her own little business of drawing medical drawings, right?
Wow, that's fantastic.
And she's very good at it, right?
Uh,
So
could this be a new evolution a little bit? I mean, we're looking at the information age where processing information is really the next step in our human evolution. We figured out how to make things, we figured out how to mine things, and now it's something a little different. Do you think it's coinciding with us, or has this always been with us?
I think it's always been with us. I think it's been with us at a different level. And I think that there were times when we speculate it might have been more adaptive, okay, in terms of the cognitive diversity, allowing people with ADHD to function in different environments, you know, the impulsivity and aggression, helping them be good hunters, you know. Um, I don't know, the people who were making the drawings in the caverns were ADHD people because they were bored and they had to do something and they were very creative, right? So I think it's always been there. I think that we grew up to develop a sense of normalcy based on our experience, culture, religion, all those different things, that you had to fit certain model, right? And a diverse way of thinking wasn't very accepted. So I think that we need to go back to that, um, because it is adaptive, not only for them, but also for us. Okay. And I'm not talking about taking advantage um, of people because of their smarts and their creativity, but being accepting of them, right, becomes, that's a code word in terms of this whole issue.
Well, doctor, fascinating topic, and I believe tomorrow possibly. Are we going to try for a second one to follow up on this since we missed last week and chat a little bit more about those who are neurodiverse and the challenges of having being a parent of a child with neurodiversity? Is that correct?
Yeah, and how to help them prepare for their becoming adults, right?
All right. Well, folks, we will see you again, I believe, tomorrow, and if not, very, very soon with that topic. Thank you, doctor, once again. I will speak to you soon.